your questions, but I just really wanted to thank Dr. Harlan and all of you today for allowing me to share the work that we are doing, and just really want to encourage all of you to reach out if you have questions, and also just want to advocate again for health coaching for our patients. Thank you. Thank you, everybody, and good afternoon and good morning to those in the West Coast. And like Dr. Harlan said, my name is Abby Cabrera, and I am a project and program manager within the Center of Excellence of Primary Care at the University of California in San Francisco. So today I'm going to be sharing with you the health coaching and the practical skills and evidence behind them. We can advance to the next slide, please. So who are we? At the Center for Excellence Primary Care, we identify, develop, test, and disseminate the promising innovations. We want to improve primary care, enhance population health and health equity, reduce the cost of care, and of course, restore joy and satisfaction in the practice. We advocate for primary care to be engaging in reflection and self-criticism. We want to challenge the conventional ways of doing things in primary care. We want to take risks in experimenting with new approaches of how to deliver primary care and educate primary care clinicians. And we also want to advance best practices and innovate. And of course, these must be disseminated and shared because we want to promote a learning community in primary care redesign. Next slide, please. So today I wanted to share with you three main objectives. So like Dr. Harlan said, there are many definitions of health coaching and a lot of individuals who identify themselves as a health coach. So I wanted to share with you all how we define health coaching and summarize some of the evidence that supports it. And next, practice and show some of the specific skills that are applicable to promoting healthy eating with using some of the health coaching skills. And then finally, what are some opportunities we can identify of using these health coaching skills in interacting with patients or clients or other individuals. Next slide, please. So why do these skills matter? Well, what is the evidence and what is some of the data behind them? Well, research has shown that half of patients leave their medical visit without an understanding of the clinician's advice. And about 1 in 10 follow the lifestyle recommendations for things such as smoking cessation or healthy eating. And about 10% of the patients involved in are only involved in their decision making. And so if we only have about 10% involved in the decision making, then a lot of our patients will leave the visit without an understanding and typically not follow what is either prescribed to them as ordered, or even in lifestyle changes or making follow-up visits. And so a third of our patients will take their medications as prescribed, for example. Next slide, please. So how do we define health coaching? So we define it as a set of skills to assess and build on people's knowledge, their motivation, and their confidence to make and act on complex decisions. So in health coaching, it's person-centered or patient-centered, it's strength-based, and it's collaborative between the patient, their family, their community, and their clinical team. Next slide, please. So we at CEPC and health coaching over the last 10 years have been gathering a lot of evidence. So we've conducted multiple randomized controlled trials of patients with various chronic diseases, so diabetes, hypertension, hyperlipidemia, and we've worked with medical assistants that have been trained as health coaches. And some of the evidence that has come up from this has shown improved A1C numbers, LDL cholesterol numbers after 1 year compared with non-health coach patients. And other health randomized control trials with health coaching with low-income patients in diabetes, we've worked with peer coaches. So we've trained some other patients who have had diabetes to become health coaches to work with their peers. And again, the evidence has shown the significantly improved A1C levels. So who can be a health coach? And Carrie, if you're able to click something, it'll show up that anyone can be a health coach. Specifically, we can talk about other members of our care team. I've mentioned medical assistants, but anyone can truly be a health coach, even you as a clinician, registered dietitian, even among you with your colleagues, your friends, your family can be a health coach. And some other areas that CEPC has used health coaching in randomized control trials or other projects beyond chronic disease, has also included recently COVID-19. So in California, CEPC, we've been involved with working with the state to develop contact tracing and case investigation, where we've been training thousands of different contact tracers to use health coaching and these health coaching skills to work with COVID-19 positive patients. And also, most recently, vaccine communications outreach for COVID-19. So, really, how can we apply health coaching in all these different manners? And what I look forward to sharing with you today is those set of skills and how we've applied it. But I really wanted to show the breadth of health coaching and how it's really worked within the clinic and the continuation of the evidence that we are building. Next slide, please. So I wanted to kind of present, a case patient. So we're meeting Elsie. So Elsie today is a 59-year-old Asian woman. She has diabetes. She wants to improve her health. Many of you might have a patient very similar. She's missed 3 of her 5 medical visits in the last year. And keep in mind, this is a little bit pre-COVID, so we're not going to include COVID as a reason that Elsie might have missed her visit. But Elsie wants to focus on improving her diet. That's what she shared with her clinician. Her last A1C was a reading of 10.4. So she's working with her health coach and saying, I want to eat healthier, especially for lunch. Let's cut out some sugar sweetened beverages and maybe cut down on some portion sizes. So when you check in with Elsie, she said, my plan is going fine, but weight is not changing. A1C is not really moving. And again, Elsie did not show up for her last telehealth visit. So what may be going on? And again, a lot of you may be experiencing this with your patients, and maybe you already have an idea of what could be going on. But what are some of the health coaching skills we can use to really figure out what's going on and help Elsie get on her path to her goal? Next slide, please. So within health coaching, we want to help patients have an understanding of the subject matter. So in the case of Elsie, we want Elsie to also understand not just what is diabetes, but maybe what is a hemoglobin A1C? What does that mean? Why is she getting tested every 3 months? Also an understanding of, what the goal really is. That it's a large goal of saying we want to improve healthy eating and reduce her numbers. But what does that really mean? What is maybe that first step to really achieving that goal? And how does Elsie feel about that? For Elsie, maybe she's saying she feels fine. She wants to improve, but is that really what she wants? So it's a way of building that understanding to really also understand how they feel. And of course, working with the patient, to meet them where they are, where you understand and they understand the advice, and it's culturally appropriate. It's appropriate for the goals that they have. And again, of course, this collaboration with the decision making. And health coaching, it just empowers the patient to play that central role in their clinical encounter and engage them in their self-management activity at home, and also a way to understand who their family, their caregivers, their community are, and how they can all play a role to support that central person. And in this case, Elsie. So who are those in Elsie's, family and caregiver and community that we can also work closely with to help Elsie achieve her goals? Next slide, please. So back to some of the research and evidence in health coaching, the impacts on health behaviors with health coaching that have occurred in the past. So dietitian or nurse coaches that were working through telephone health coaching, they had greater reductions in cholesterol and even better adherence to lipid lowering drugs than patients who were in the usual care. So health coaching doesn't always have to be delivered in a person-to-person setting. we've also shown that through the telephone it's worked. Another impact in African American Latino adults with diabetes, they were coached by community residents, again, also showed a decline in A1C levels compared to a control group. So Mexican American patients with diabetes working with a peer-led education intervention, they demonstrated improvement in glucose and metabolic control, again, compared to a control group. And then patients who had diabetes with nurse coaching demonstrated better self-reported diet um, and compared with usual care. So again, they might not have had the significant A1C reports, but better self-reported diet is something that's a step in the right direction. And then in clinical measures, community health workers that were trained as these coaches. So this is in asthma, so not quite in diet and food, but still in a chronic disease manner. They reduced asthma rehospitalizations compared to those in a control group. And again, in a clinical measure, hospitalized patients who were receiving post-discharge assistance from a transition coach, like a health coach, they were significantly less likely to be rehospitalized. So again, there's a growing amount of data that is showing, the impact that health coaches have for the individual patient. And also, again, like we're showing in these clinical measures and rehospitalization. And that's very important for our clinics and for our hospitals. Next slide, please. So in this slide, it's a lot of the information that we already know. 1/3 of US adults are obese, 17% of children and adolescents, 2 to 19 are obese, and so on. So again, just resetting the stage that we know that we want to help improve the health, the diet, the wellness of our patients. And in chronic care management, beyond just the patients adhering to their clinical guidance, they also have to have an understanding of the knowledge of their condition and what are some of the skills that we can use to build their confidence, participate in their own care, and also beyond just participating in their care, again, how can they have those in their family involved to help with their care and really build that trust again with their clinic partners to be involved in their care in a strength-based approach. Next slide, please. So again, anyone can be a health coach. And what are some of the roles within health coaching? So in self-management support, we talk about a lot of promoting behavior change and, some of these problem-solving skills. We do encourage a lot of follow-up and active participation in the patient's life and how they are doing with the steps that they'd like to take towards their goal. And a health coach is also a bridge. It's a bridge between the clinician and the patient, and not just the primary care clinician, but it can also be a bridge to other clinicians like behavioral health and so on. So it's really that liaison, that advocate. It also ensures that patient can understand the care plan and also we always advocate for cultural and language access for patients to also have an understanding in something that they understand. So whether it be in a different language or visual, a health coach can also help bridge that for the patient. And also health coaches have been able to navigate the healthcare system along with the patient. So a lot of times with our patients, they have a lot of labs or they have to, get prescriptions for their medicine. Sometimes there can be insurance hangups. And so health coaches have also really been that extra support and voice and advocate for patients who are not quite successful all the time in navigating, the difficulties in the healthcare system. By doing this, they can empower the patient to take charge after they've walked the patient through, maybe, for example, refilling a prescription and there was maybe an insurance hangup. But once that is resolved, the patient can also have that knowledge and self-efficacy to continue that on their own. And again, just giving the patient another person in their corner to give themselves a voice. Our health coaches have also shown the support and connecting, really, really connecting. I've mentioned this before, but a lot of our successes also is really in connecting to behavioral support, especially during our pandemic. That has been really successful for some of our patients working with health coaches. And emotional support is something that's very, very important because a lot of what our patients are going through with their chronic diseases, some of this is lifelong. And again, throughout the pandemic, there's been extra emotional support that is needed for our patients. And so that the health coach can also really play a role in being that advocate, helping the patient in ways, showing compassion and even teaching coping skills and just really being an ear. Some of our patients have also become isolated. And so the health coach has also allowed them to really just, share what's been going on and just be there for the patient before connecting them even to the healthcare system. And in healthcare, we always want to ensure that there's continuity and follow up for our patients. And so health coaches have also provided that ability for a patient to, continue their care with their PCP and so on, and even reach specialists that might have been they might not have been able to do in the past. So the big part of all of these is that the health coach can also really help establish trust. And the health coach can represent not just, the care team, but they might also represent the clinic or even the healthcare system as a whole. And a lot of patients don't trust a healthcare system, but a health coach has been able to really start to build and establish that trust within the patient setting. And so eventually to hopefully build trust into the whole healthcare system. Next slide, please. So what are some of the skills that are applicable to promoting healthy eating and the different health coaching skills that we've used to build our evidence base? Next slide, please. So these are the 4 health coaching skills. And as you read through it or hear me explain them, I want to mention that, these may be inherently simple. They might sound very straightforward. And again, just, inherently simple. But what I want to emphasize is that, again, it's a set of skills. And as you practice these skills, there are different steps in between them that really can bring out the full health coaching, ability to help your patient. So the first step is setting the agenda, and when we're setting an agenda, it's really setting the stage for your patient. And again, with all these skills, they really take practice of how you can, build it in, because we know that there's not a lot of time available when you're seeing a patient. And how can you incorporate all these skills, or how can you emphasize which skills are most important based on the time you have and the immediate goal that the patient has. But setting the agenda is the first skill. Patient and coach can say what they would like to discuss. So it kind of, there might be a lot of things on a list, but what are some of the main things that the patient wants to discuss? And what are some of the main things that the clinician would like to discuss? And then we use ask, tell, ask, and this also includes closing the loop. So some of you also know it as teach back, but it's a really collaborative communication. And it's a method that asks the patient, we use open-ended questions. We assess on their existing knowledge and skill, or their existing knowledge, and then we share information. So the first ask, what concerns do you have today? Or, what do you know about your A1C level? And the tell is what the patient is letting you know of what they know. And of course, if there are gaps in that knowledge, the role of the health coach is to also fill that. So that's where you share some of the knowledge, or you clarify maybe what may be misinformation of what they are sharing with you. And then the final ask is going back. I know we shared a lot today, and just to make sure that I did a good job, would you mind sharing in your own words what you now know about your A1C test? Or will you be able to share what you now know about your condition, or what you now know about ways to eat healthy? So again, in that final ask, we don't want it to seem like it's a pop quiz or that you can put the onus on yourself. I just want to make sure I did a great job of explaining this. Would you mind telling me in your own words, or, what you now know? And then when we move on to action planning is our tool to engage in behavior change discussion. And so this is where, you might have a large goal for a patient. Large goal may be to improve their health or, have better eating. But sometimes those large goals are hard to attain. And so if you break that down into smaller steps, you can create an action plan for that smaller step. And the step can even be, for example, to say, I really want to cut down, like Elsie said, she wants to cut down on sugar sweetened beverages. Let's say Elsie says she has, a few sweetened sugar beverages a meal, and maybe she wants to cut down. And so instead of saying in an action plan, let's just cut out sugar sweetened beverages completely, let's work with Elsie and say, what are your thoughts about maybe taking one of those drinks away a meal? Let's start with that. And so working with the ask, tell, ask again, what are your thoughts about that? How do you think that will improve your health? So we can use action planning to also set those smaller steps that will in turn lead to, making the larger change in the goal. And in this final one, you can again close the loop of the entire steps that we've made. So what I wanted to do next is really go in again into more depth of ask, tell, ask. If we can go into the next slide, that just highlights what we'll be doing. And then one more slide, please. So again, it's this 3-step process that we're communicating. It's this balance of asking and telling. And you can think of it again as a continuous loop, because as you're asking these open-ended questions and you're filling in some of the gaps, or maybe your patient is already in full understanding and you could move on to a next skill. But again, it's a way to fill in gaps, to clarify some misinformation, and just really build on that knowledge of what you are assessing with the patient telling you. We want to continuously use open-ended questions. So this is very similar, again, to motivational interviewing, but all of these open-ended questions. We want to avoid saying, do you understand? Again, that's a close-ended question. What we like to do is put what in front. So, what questions do you have? Or, do you have any questions? We want to change that to what questions do you have? So continuing to have those open-ended questions with our patients is another way to really build on what they know and what they don't know. And one example I'd like to share with in one of our studies with COPD, we were getting ready, one of our health coaches was getting ready to share a lot of information about COPD. But beyond just sharing, and maybe the patient wasn't ready to listen or wasn't ready for all that information, we asked, what do you know about the condition that you have of COPD? And we found out that this patient had attended an 8-week class already, understanding, and I was able to explain their condition, understood what all the tests were, understood their numbers, understood the differences between their inhalers. And so that allowed us to move on to the next step. Instead of our health coach just launching into all this information about what is COPD, what is, and perhaps the patient just shutting down because they already know, we were able to find out that they already knew all their information. So that's also another way that ask, tell, ask can be beneficial. Next slide, please. So again, why ask, tell, ask? And some of the evidence, patients who collaborate in making their own care are more likely to adhere to the care plan. Again, these are inherently simple, they make sense, but when you're with, your patient, sometimes, the time is running through. And so we want to really incorporate this ask, tell, ask. How do you feel about your health? Or what do you know about your condition? Or maybe even you can really ask, what are the barriers? Or through ask, tell, ask, you will start to identify what the barriers are and some of the past experiences that the patient has had that has not helped them be successful in the change they would like to make. And again, this also helps us assess what is their readiness for change. So in the case example, let's say Elsie is saying she wants to improve her health. She wants to cut out sugar-sweetened beverages. She wants to eat healthy. But when we start to discuss, potential action items, maybe there's a little bit more of a hesitancy. And so we can go back to, really working on what is the understanding, or how the patient feels about, when they might be ready for change. And then you can move on to the next skill. Next slide, please. So again, we ask open-ended question. What concerns do you have, or what do you know? We want to learn more about their perspective and knowledge. And again, based on what they respond, we tell with filling in again those gaps or clarifying the information. And that final ask is closing the loop. And you can use other open-ended questions. And again, if you're in that final ask and the patient is just, a little bit off with their information, they may still have more gaps, you can begin the ask tell ask once more and just, clarify again, and tell the information and keep going until the patient has had that understanding. Next slide, please. So these open-ended questions can really help the coaches, again, gauge the patient's perspective, where they are in their health, where they might be ready for change, where their knowledge is, and also what has worked for them in the past. What are, again, those barriers, and what are the real key motivators for self-management? And this picture on the right is, we trained barbers to be health coaches in hypertension. And so this is a live picture we took of barbers, working through ask, tell, ask. And in this ask, an open-ended question, for example, is, what are your concerns about your reading in patients for hypertension? And so the barbers that are becoming health coaches and informed, will be able to hear from their clients, oh, I'm frustrated, I'm scared about my numbers. And so the barbers can finally ask, how can we help you to achieve and set your goals in regards to your blood pressure? Or what are some ways I can help you to reduce your blood pressure? Next slide, please. So I've shared some of these, but here are just some other examples with the open-ended questions. What are some ways you can lower your LDL cholesterol? And of course, your patient can share some information, and you can always respond, thanks for sharing. We always want to, again, show the reflective statements of active listening that we learn from motivational interviewing. And of course, gratitude. So thank you for sharing. Yeah, that's great. Here are some other ways to lower your cholesterol. And that final ask, and not just closing the loop in a robotic way of what did you now learn? You can always ask, what do you think about incorporating some of those suggestions? It's a very interactive way. And that's a way that you can also assess if there are key motivators or barriers again. What do you think about incorporating these suggestions? Next slide, please. All right, and then I want to go into the final skill. The other skills you can read about, but I wanted to share some action planning. So next step, please. Next slide, I mean. So in action planning, I shared that this is also a skill of how we want to break down maybe the larger goal and what are some of those smaller steps or smaller goals to lead to their health goal. So this action planning can ensure that we get the patient's perspective, again, with maybe barriers or concerns of taking action to improve. There's always intention, but what about the next step of that action? So this is a way to get that patient-centered solution working towards achieving their goal. So some more evidence, patients were randomly assigned to traditional patient education goal setting with action plans. So the group who was doing an action plan had a significant reduction in their A1C compared to the group that did not. And in other evidence, in another randomized control trial, patients who were encouraged to participate in their clinical visit reduced their A1C from 10.6 to 9.1, while those who were in the control group only went from 10.3 to 10.6. So these are some of the evidence that has been built. Next slide, please. So we always, again, want to ask permission. It sounds like you're worried about your cholesterol. Would it be helpful to talk about this? And we want to ask permission about that. Is this something that we can go in and talk about? And then you can develop a menu of options, first based on the patient and what they think. So, what do you think would work best for you to lower your cholesterol? If patients don't have any ideas or they're just unsure, we can always say, would it be helpful if I share what has worked for other patients? Would it be helpful if I share what has worked for myself, even? And then, you want to continue with questions to get specific of how they can start to achieve this goal and make it more tangible. What is the first step? Who could help you with that? So for example, what is the first step? Maybe the first step is I want to reduce, my sugar sweetened beverage consumption each meal, if that's Elsie. If Elsie is saying that, what is the first step that you could do with that? She can say, maybe let's get rid of one a day. Maybe not each meal, but one a day. Or who could help you with that? Maybe I can rely on, maybe my kids can help me, maybe with the sodas, or I can ask my spouse not to buy so much or not, or have more water around the house. There are many different ways. You can always use a confidence ruler if you want to assess that readiness for their change or their action. So, on a scale of 1 to 10, how confident are you? And we like to use the number 7 as really that goal. So if somebody is below a 7, let's keep assessing, how can we get you up to a 7 in that confidence ruler? And again, we always continue to close the loop, just to be sure we're on the same page. What will you do tonight? Or, when will you contact, your sibling to help you with that? Or, let's remind ourselves, what is that first step that you're going to do towards reaching the goal? Next slide, please. So again, just reassessing, the steps that we like to take in the health coaching when we're working with patients. And mostly these have been in randomized control trials. And, when we do teach health coaching skills to medical assistants or different clinicians, we go through all of these skills and these steps. Next slide, please. So what are opportunities to use health coaching skills in interactions with patients? Let's go through some of those. Next slide, please. There's other opportunities. We want to also make sure patients know their numbers. A lot of times with different chronic conditions, we rely on labs to help us identify where the patient is in their goal. But a lot of patients don't know their actual A1C or what their A1C goal is. And so a lot of times we want to help them know their numbers. This can also apply to hypertension or really any chronic disease. And if we're talking, through healthy eating beyond just some of the lab numbers of, cholesterol and so on, sometimes patients want to know, what is the caloric intake that I should be eating? And so again, this idea of knowing their numbers and understanding what these numbers mean and how you can use health coaching and ask, tell, ask, or action planning to help patients understand all of that so that they can improve their health and well-being. And it's also very helpful, again, in medicine, in medication reconciliation, and how to adhere to that. And so I mentioned that we've also worked with patients with asthma and COPD. And so how can they understand their adherence or even the reconciliation with their inhalers and their controlled inhaler versus their rescue inhaler, and even the proper ways to take their medication. And of course, I mentioned this earlier, but the other opportunities that we've developed is, through contact tracing and case investigation throughout this pandemic. And currently, we're also implementing health coaching in training those who are doing vaccine outreach throughout the state of California. And so those who are doing the vaccine outreach, calling individuals and citizens throughout the state, use health coaching skills to assess on someone's knowledge of what they know about the vaccine, telling and clarifying some of the information and closing the loop to help build somebody on their knowledge to give them the decision of whether they do want to receive the vaccine or not. And also for contact tracing, how successful they can be at quarantining or self-isolating. And so again, with this evidence, more randomized control trials showing that ask patients, with ask, tell, ask, using that with diabetes, two questions showed patients improvement in their glycemic control more than a control group. So again, knowing their numbers if you're talking to a patient too. What is your glycemic number? What is your goal? What is your A1C goal? And patients, when we're using ask, tell, ask, had better control because they understood where they needed to go. Next slide, please. Looping back to Elsie. So we went through what her goals were, her conditions were. But if we're working with Elsie as a health coach and we're using the two skills that I focused on today, we can start working with Elsie, Elsie, can you tell me, what do you know about diabetes? And, what concerns do you have about your A1C? How do you feel about a telehealth visit? I mentioned that Elsie did not show up for her last telehealth visit, but again, let's see, what can come up can, show a vast array of reasons why Elsie did not show up to her telehealth visit. And so using ask, tell, ask in these open-ended questions, reflective listening, active listening, also very important. And if we're working closely with Elsie in action planning, what would you like to work on to cut out sugar sweetened drinks? And as Elsie tells you some of these responses using that confidence ruler, let's assess where this is on a scale of 1 to 10. How confident will you try that? Because let's say Elsie said, maybe I'll just cut out all the sugar sweetened beverages. That's better for me. I know I shouldn't drink that many. Let's just cut it out. Okay, Elsie, let's talk about that. On a scale of 1 to 10, how do you feel that you will be able to really cut out all the sugar sweetened beverages right away? And maybe Elsie says, oh, I don't know, I really, really need them. So maybe I feel that it's about a 4 or 5. 5, maybe I can, maybe I can't. Well, Elsie, we really want to get you to a 7. So let's reassess that goal. What will make you feel that, what's a goal that you can make right now to feel at a 7? And again, maybe Elsie will say, let's cut out 1 for now, or 1 per meal. So these are some of the ways that you can do that. And again, closing the loop. All right, Elsie, until I see you in your next visit, what is something that you're going to try tonight that you feel is a confidence of 7? And in Elsie's words, she can state it on herself. Next slide, please. These are the take-home messages that I'd really like to leave you with. Again, patient-centered, meet people where they are. So this means, that you're really understanding the patient's concerns from who they are within themselves. Maybe there's also cultural implications, family implications, socioeconomic implications. So what is the information or the support they need to make that decision, where they truly are? And you also can find this out with ask, tell, ask. We want to use a strength-based approach. You listen for their strengths and resources. Maybe they have a deep connection with their faith-based community, or maybe they receive support from their children. You really want to build on that. Again, it's their motivation. What is it? So you want to identify it and build on that motivation and that knowledge. And if possible, even include them, include that community, include those individuals in health coaching along with the patient. And so together they can build on their goals. And again, it's collaborative. Health coaching is very collaborative. We want to engage patients because they're the expert in their lives, and we want to build on what they know and address the barriers to help them achieve their goal. So engaging with the patients in their lives, we want to understand how they carry out the behavior change. Next slide, please. So I want to leave you with our website. We have materials that you can download and that you can access. So it is cepc.ucsf.edu. Please feel free to also email me. I know there were a lot of questions in the chat. I will be a part of the panel also later today that we might be able to address some of your questions. questions, but I just really wanted to thank Dr. Harlan and all of you today for allowing me to share the work that we are doing, and just really want to encourage all of you to reach out if you have questions, and also just want to advocate again for health coaching for our patients. Thank you.